Hello, my name is Lorrie B, and I'm a yoga instructor and a yoga therapist. And we're going to have a nice gentle practice today, hip opening and a little bit of hip strengthening. I chose to do hips because we've been doing so much sitting during this whole past year of 2020. We're in 21 now, but during the pandemic, just so much sitting, and it wreaks havoc on our hips. They get really tight. So I just wanted to bring this little practice to you guys. So let's get started. So what we'll need for props today is a strap of some sort. A towel will suffice if you don't have a strap, or a tie, or a belt off a bathrobe. So if you don't have one, you can go maybe pause this and go get one. Also a yoga block. If you don't have that, you can use a pillow, or even get a bath towel or two and roll it up tightly. And what we're going to use that for is to put between our knees when we do bridge pose, to squeeze. So it works our inner thighs. So anyway, those are the props: a block, a yoga strap, and possibly a little support for under your head, a blanket or something. Okay, let's get started. So as we get started, we're going to start with some breath work. And I'd like you to try to get a chair, or maybe you can use your couch or sofa, something to put your legs up. It's a very resting, restorative posture. And right now, at the beginning of class, we're just going to try to quiet down and get in touch with our breath and just sense our body right now. So let's come onto our backs and swing our legs up the chair. Now, what I want you to notice first, do you see how my knees are not touching the back of the chair? That's not what I'm looking for. What I'm looking for is so that the knees are supported by the back of the chair. My whole calves are up on that chair, and I've got just a very little support under my head. When we lay down, we want to think about having our chin at the same height as our forehead and chin at the same height. So as you lay down, if you're looking and your chin is down lower than the forehead, we might want to get a little bit of a towel or some kind of a support to put it on our neck so that we maintain that forehead-chin alignment. Now, conversely, when you lay down, if you have your chin poking up high like this, which is it goes with that rounding of the upper back and the forward shoulders, then we need to get a little bit of a blanket or something and put it under the back of the head and the biggest part of the skull, and try to find that forehead chin level. So depending on how rounded you are, you have to really look at yourself in a mirror and put as much height as you need to find that levelness of chin and forehead. Let's bring our palms face up. And just feel right now. Feel your body right now. Close your eyes. And feel your body supported by the chair and the floor. And just feel it. And now I'd like you to bring your awareness to your navel, your belly button. And we're going to practice breathing into our belly button, into our belly. Diaphragmatic breathing. In yoga, we breathe in and out through our nose. So we'll be doing that. So as you inhale, I want you to breathe in and breathe in so that your belly rises up on the inhale. And as you exhale very slowly, you're going to feel your belly subside and go back towards the floor. And again, inhaling in through the navel, the belly rises up. And then as you exhale, the belly falls really, really slow. I'm going to add a count to that, a cadence. So now as you inhale, you're inhaling 1, 2, 3, and 4. Add a little pause. And then as you exhale, 4, 3, 2, 1. And pause. Now, if that cadence was too much or too little for you, you can change it to meet your body's needs. But we're going to just use that for right now. So as you inhale again, inhale 1, 2, 3, and 4.
exhale, 4, 3, 2, and 1. And let's do 3 or 4 on our own. So whatever count is yours. Each time you exhale, feel your body sink and get heavy. As if you're leaving an imprint on the mat, on the seat of the chair. And again, inhaling. And then exhaling, sink down heavier. So your body gets heavier each time, letting go of tension. Sink deeper. Don't speed up your breath. Keep breathing. So after a stressful day, doing this type of breath work for about 4 or 5 minutes really helps to calm you down. Or if you have trouble with anxiety, this diaphragmatic breath is such a healing breath. It's helping with immunity right now. It's moving lymph through your system. It's starting to stretch your abdominals. It's sending a message to your nervous system that everything's okay. You can slow down and quiet and relax. All that with our wonderful breath. Feel where your feet, just gently, the heels touch the seat of the chair. Then feel your calves. Feel the backs of the knees. Feel your hips, your buttocks where they're supported by the floor. Feel the mid-back and the shoulders, the elbows and the backs of the hands. And now feel the back of your head. And let's take about 4 more deep breaths. Inhaling deeply, surrendering fully. Inhaling deeply, letting go of more tension. Inhaling deeply, letting everything go and soften as you exhale. And 1 more, please. Now, before we move, I just want you to take an inventory of how you're feeling right now. Have you noticed any shift in energy? Hopefully that little bit of breath work, we call that pranayama, help to relax you and get our bodies ready now for the practice. So now coming off the chair, what I want you to first do is draw your navel in and zip it up a little. So lift your navel up a little bit. That's going to support your lower back. That's contracting your core muscles a little bit right now. And then bring one foot up, the other foot up, and then roll over. Use the top arm just in front of the shoulder. Keep the navel core really pulled in and push yourself up. And now let's move our chair and get it out of the way. I'll take a little sip of water and we'll get started. So first what I'd like you to do is lay down. You can have a little support under your head, just a little bit. We don't want to promote that forward head posture, so not much. Just remember, chin leveled with the forehead. So first what I want you to do is lay on the floor, feet are bent, knees are bent, feet are flat on the floor. I want you to take your hands and place them right on your frontal hip bones. Now you might think, where the heck are those? You can take your thumbs and put it in your navel, and then reach your pinky fingers out to the side. And there's two frontal hip bones. They're called your ASIS bones, anterior superior iliac spine. I'm going to refer to them as your as-is bones. So as-is bones. So right now, let's practice our pelvic tilting. So a lot of our tight hips and our tight hamstrings and our tight psoas muscles are due to the way that we carry our body through life. Some people carry it in an anterior tilt, so keep your hands on your ASIS and rock your pelvis forward, creating a big arch in your back. That's called an anterior pelvic tilt. That's usually associated with a tight psoas muscle. And now conversely, I want you to gently push your back into the lower back into the floor until it's flat. So this, once again, is called a posterior pelvic tilt. Some people that have tight hamstrings walk like this, live their life like this. Neither one is optimal. What we want to find is the medium ground between the anterior tilt and the posterior tilt. So keeping your hands right on those ASIS, just gently tip your pelvis forward until you're right in the middle of both. So you're not too much forward, you're not too much back, you're right in the middle. So that's what we're trying to instill into our bodies, to retrain it, to keep our body in this neutral pelvis, we call this. But let's do a little more of this pelvic rocking and tilting. It's really good for your low back. It loosens it up and it just helps you feel good. So fingers on the as-is bones. As you inhale, feel your belly just, if there was a bucket of water here, it would pour forward. So inhale, pelvis tips forward. And then exhale, I want you to pull your tummy in, press your lower back flat. Feel the pelvis rock back. And then inhale, tip it forward, inhale, big belly. And then the exhale, pull the belly button towards the spine so that you're using your core muscles to push that back flat. And inhale, let the pelvis rock forward again. And then exhale, pull the tummy in straight down so that you feel like your back is being pulled to the mat. And then inhale, pelvic rocks forward, anterior tilt. And then exhale, pelvis rocks backward, posterior tilt. And let's do two more. Inhale, rock it forward. And exhale, back, pull the navel in. And last time, inhale, rock it forward. And then the exhale, navel to spine, and then just gently push the lower back flat. Now come right in the middle of the two. This is called a neutral pelvis. This is what we're trying to learn, teach our body how to remember how it should be. When we're in neutral pelvis, you've got that nice little low back curve, the lumbar curve in it, and we want that. So now what I want you to do is bring awareness to your left leg, keeping neutral pelvis. So you've got this neutral pelvis. So think about your ASIS bones. They have, they're magnets and they're drawing towards one another. So it's a feeling like everything going towards your navel. So try that. Take an inhale. And then as you exhale, draw your ASIS bones towards one another. That's contracting your transverse abdominis muscles, deepest core musculature of your abdomen, of your abdominals that support your lower back. Super important. So we find neutral pelvis, then we lock it in by drawing our ASIS towards one another. So I want you to keep this as we do the next exercise. So keeping neutral pelvis, bringing awareness to the left leg. As you inhale, I want you to slide the heel on the floor until the leg is straight. Don't let the pelvis move. And then the exhale, bring the heel back up. Let's do the right leg. Same thing. Don't move your pelvis. Keep ASIS together. Inhale, let's bring our light, slide it till the leg is straight. And then the exhale, bring that heel back in. Inhale, left. This is very good core work for you. And exhale, bring it in. And we're warming up our front of our hip, our psoas. Inhale, right leg straight. And the exhale, bring it in. If you've got that feeling of ASIS drawing together, bring your palms face up. So the inhale now, left leg slides. And then the exhale, the heel slides back. The inhale, the right heel slides until the leg is straight. And then the exhale, you're dragging that heel till the knee is bent. Let's do a couple more on each side. Inhale left, and exhale, drag it in. Inhale right, keep neutral pelvis. Keep those ASIS drawing towards one another with that little bit of an arch. And last time, left straightens, and the exhale, dragging it in. And the inhale, the right leg straight, and the exhale, dragging it in. Now, draw your knees to your chest, rock side to side, and circle around. Just circle, circle. And then go the other way. This is just a little bit of a relief for that low back. Now, let's bring our feet down. Now, let's find our neutral pelvis. So if you need to tip back and tip forward and then come in the middle, that's fine. And then think about your ASIS or magnets, and they're attracted to one another, so they're drawing together. Your core is engaged. I want you to straighten your left leg. Keep the right knee bent. And now look at your foot. Don't let the toes kick out to the left. I want you to be on the center of your heel and the toes flex, the foot flex with the toes straight up. Keep neutral pelvis. So we're going to take a breath in. And as we exhale, we're going to raise this leg up about 4 or 5 inches. And then inhale, lower it. Same leg. The exhale, lift. So you're not lifting it all the way up. It's just a little lift. And inhale, lower. And exhale, lift. Keep ASIS towards one another, keeping neutral pelvis. And then exhale, lift. And inhale, lower. And exhale, lift. And inhale, lower. One more time. Exhale, lift. And inhale, lower. Now slide that leg up. Keep neutral pelvis. And then slide your right leg straight. Middle of the heel, foot is flexed, toes are straight up. Now, neutral pelvis, draw your ASIS together. Inhale. And as you exhale, lift your right leg up a few inches. And inhale, lower. Exhale, lift. Bring your arms, palms up. And exhale, lower. Exhale, lift. Inhale, lower. How are your ASIS doing? Draw them together. Exhale, lift. And inhale, lower. Exhale, lift. And inhale, lower. Feel the front of the right hip. Exhale, lift. And inhale, lower. Couple more. Exhale, lift. And inhale, lower. And then exhale, lift. And inhale, lower. Great job. Draw that heel back. Once again, let's circle our knees around. So that was a gentle core strengthener. And what it did was start to give a little bit of warm up to the front of our thighs. We want to warm up a muscle before we stretch it. Think about taffy. You get a hard piece of taffy, you hold it in your hand for a little bit and warm it up, and it's pliable. Same thing with our muscles. Stretching a cold muscle, you're not going to get the best stretch out of it. So we want to warm it up, and that's what we did. So now we're going to stretch our psoas a little bit. So once again, we're going to roll to one side, hold your navel in and up, top hand in front of the shoulder, and then push yourself up. Okie dokie. So now we're going to do just a very gentle stretch of our psoas. So I want you to come on hands and knees. And notice that my hands are right under my shoulders and my knees are under my hips. And I've got a little bit of an arch. Let's do the cat and cow first. Let's learn about neutral spine when we're here. So come into the tabletop. You're going to have your hands spread wide, fingers are spread wide. Your index finger is pointing straight ahead. Now, the eye of the elbow rotates forward, bringing the upper arm into external rotation. So that's how we want to keep our arm placement, our hand placement, to keep our shoulders safe. And now your hips are right below your knees. So now as you inhale, gently pull back on the hands. I want you to lift your head and lift your tail up, make an arch in the back. And then as you exhale, push the floor away gently, draw your navel in and tuck your chin. So the inhale, lifting the chest
and the head and the tail. And then exhale, pushing the floor away. And let's do a few more times. This is good for your spine, brings movement and fluids into the discs. We need to move. We need to move. Couple more. Cat and cow. And last one. Good. Now, can you find neutral pelvis here? So it's not too much of an arch, it's not rounded, it's right in the middle. Then you draw ASIS towards one another. Okay? So now what we're going to do is we're going to bring our right leg back and just curl the toe under. So this is, we call this just a nice gentle stretch for our psoas muscle. So I want you to keep that neutral spine, and I want you to push your hands away, push your arms away, fill in that space between your shoulder blades, and then engage your core, draw your navel in and up, and press through that right heel. And just get some stretch in the front of the hip. You're going to feel it in the front of the right hip. And let's just stay there a couple more breaths. Keep pushing the floor away. Keep drawing your navel in and up. And you're stretching the front of the hip right now. Let's stay here 2 more breaths. Just push it. You're also stretching your calf muscle. So giving the hip. So really pull your navel in right now. Lift it up. Navel in and up. Feel your tailbone grow heavy, and it points towards your heels. And just feel the front of the right hip, opening it up. And 2 more breaths. So we really want to give it a little bit of a time. We warmed it up, now we're giving it a good long stretch. And then bring that knee down. Come down to your child's pose. I like to put one fist on one fist and just come down and take a break. Breathing deeply. Notice if you feel any different. Maybe your heart rate went up a little bit. And let's come back up and do the other leg. So let's get our hand placement right. The index finger is pointing straight ahead. Your fingers are spread wide. Your eye of the elbow rotates forward. Then you push the floor away gently. So we got our shoulders in good alignment. Now let's bring our left leg back and just reach back. Pull your navel in and up. Press through the left heel and gently feel like your tailbone is pointing down. So bring your navel in and up and point the tailbone down. Push the floor away. Push the floor away. And breathe. Navel in and up, tailbone heavy. Left heel is reaching back as your crown of the head reaches forward. So really get a good long stretch in your spine as we bring in our awareness to the front of the left hip. So pull up your zipper in your core. Zip up your core, navel in and up, tailbone heavy, press through that left heel. Keep your navel in and up. Keep the floor pressing away from the shoulders. So you want to keep your shoulder blades on your back, working serratus anterior. Couple more breaths. Good, and then come down. All right, let's grab a strap or whatever you're using for a strap, and you need to have something under your head. So I'm going to use a block. So when we're laying down, you never want to lay like this. You can use your arm if your shoulder allows that. And you don't want to have too much under your head so that your neck is pointing or your head is shooting up. You want to remember to keep your head in level with your spine. So this is about enough. So now what I want you to do, we're going to stretch out the front of our hip a little more. So as you can see, I'm laying on my left side. I've got my knees right out from my hips, and then my ankles out from my knees. This is called 90-90. So we want to get into this position first. Find your ASIS, remember those, your frontal hip points, and draw them towards one another. And then zip it up
Navel zipping it up, tailbone is heavy, pointing down. Now take this top leg, and if you can, let's grab this ankle. If you can't reach it, here's our strap. So we can put a strap around this. What we're gonna do is drag this leg back, pull it back. So you can use your ankle or that strap. But as soon as the leg comes back, you wanna really pull your navel in and up and point your tailbone down towards your foot, towards down. And what that does, it keeps your lower back lengthened so that it doesn't get compressed and pinched even. So we want to remember that. Navel in and up, tailbone heavy. You should feel this on the front of the right thigh. So we're opening up our hip right now, our psoas muscle. This is one of our muscles. This is actually your quads, your rectus femoris here. There's a lot of different muscles here that either, you know, the quadriceps or the hip flexors. So right now we're kind of doing quite a few different muscles, but mainly your quadricep muscles. So just breathe into it. Deep breath, close the eyes. Feel the sensations you're feeling. Nothing should hurt. You never want to push into pain. Navel stays in and up, tailbone heavy. So we're going to stay here about 30 more seconds. I'm going to keep you in this a little longer. The fronts of the hips and the backs of the hips have a lot of fibrous fascia, which is connective tissue. And the connective tissue takes longer to let go, to stretch than the muscle does. So your connective tissue encases every muscle, every cell, every bone in your body, and it's tougher. So it takes longer to stretch. So as we stay in this a little bit longer, you listen to your body. If your body's hurting or telling you I need to come out, then you listen to that. But if you can hang with me, let's stay in it about 15 more seconds. Keeping your navel drawn in and up and the tailbone heavy. Super important. It gives more of a stretch to the front of the thigh that we're working on, and it keeps the low back safe. So we want to remember to do that. Couple more breaths. Don't stop breathing. And then slowly straighten the leg and then bring it down. Let's flip it and do the other side. So onto the other side with or without your strap, if you need it or not. And you know, when we use these things, I never want anyone to think it's like a crutch. These are props, they're tools that help us achieve what we're trying to achieve. We're all unique, we all have different bodies, and it's all okay. So let's bring our knees out from our hips and then our ankles out from our knees. Let's draw our navel in and up and draw your ASIS gently together. So now as soon as we bring this leg back, your lower back is going to want to arch. So to counter that, navel in and up, tailbone heavy, and then grab your ankle or use your strap, whatever you're using, and then just start to bring that foot back. And breathe through it. Now think about this top shoulder. Is it rolling forward? Let's bring it back onto where it should be. And breathe now. Inhaling, feel the stretch. Should feel it right in here, not on the knee, not up here, just in the middle of the quadricep. And if your knee's up high like this, try to bring it down. Work towards bringing it down so that it's straight out from your hip. And we honor our bodies where they are today, right now. And we're dedicated to our practice, and we just keep doing this, and our body will slowly open up. Let's breathe. Slow exhale. If you know the Ujjayi breath, that ha breath, let's do it now. So inhaling with your mouth closed, you're saying the ha with the mouth closed, and then ha with the mouth closed as you exhale. So it's inhale ha and outhale ha, but the mouth is closed. You're just constricting the back of the throat. But it slows the breath, and it gives the mind a focus because we can hear it as we soften and let go into this stretch. Remember, navel in and up and tailbone heavy. And let's stay here about 15 more seconds. Nice slow breath. And now let's slowly bring our knee down, straighten the leg a few times, and then bring your knee down. And the top arm comes in front of the shoulder and you push yourself up. Okay, now we're gonna work, we worked on the front of our hip, now we're gonna work on the back of our hip. So since we're here on the floor today, let's come onto our bellies. So if it bothers your back when you come onto the belly in prone position, try it first, see how it feels. If your lower back is complaining from this, then the way that we help with that is we get a blanket, maybe not too high of a blanket, and we put it right in our abdomen area. So here's your navel. You want to have it right here, just in this quadrant here, from the crease of the hip to the navel. And you just lay down on that and then come down and see if that feels better, and just wiggle around until you find that spot, that sweet spot. So let's bring our forehead down, palm on top of palm. And let's just try the left leg first. So we're gonna just bending the knee. So let's breathe in. And then the exhale, just bend the knee. The inhale, straighten the other side. Now exhale, bend, and inhale, straighten. So we're starting to warm up our hamstrings. We're 3 muscles on the back of the leg. And just do a few more. Now both at the same time. Exhale, bend the knees, and then inhale, straighten the legs. Draw your ASIs towards one another so you're protecting your back. And down, do about, a few more. Exhale, bend, and inhale, straighten. And exhale, bend, and inhale, straighten. One more. Exhale, bend, and inhale, straighten. Now bring the forehead down. I want you to reach back your left leg a little and then reach back your right leg a little bit. Pull your navel in and up. And I want you to lift your left leg a couple inches off the ground. Lift those so that you're lifting. Think about the inner thigh, the inner knee, the inner ankle lifts. And then bring it down. Go to the other leg. So now right lifts inner thigh, inner calf, inner ankle, and down. Stomach is in and up, and lift left. Hamstring working, a little bit of glute, and lift right. But we want to get into the habit of lifting with the inner thigh, inner knee, inner calf, and down. And then think about the right leg, inner thigh, inner knee, inner calf lifts. And 2 more, lifting and lowering and lifting and lowering. Last time, lifting and lowering, and then lifting and lowering. Bring your hands so that they're under your shoulders and press yourself up. Okay, so we've warmed up our hamstrings a little bit. Let's warm them up a little more. Now this is also for your glutes, your posteriors, your glute max. So I want you to take a block and come down on the mat. Knees are going to be bent. Take your block. Let's put it between our thighs. So I don't want your heels clear up to your buttocks, just a little bit away. So as we squeeze the block, we're working, there's 3 hamstrings. We're working the inner hamstring and the middle hamstring. Also the adductors, the inner thigh. So we're going to do bridge in a couple different ways. So the first way, I like to have your arms at your side with your elbows bent. So make sure your elbows are clear to your side. They're not out here, they're clear to your side. So first of all, we're going to take a breath. And as we exhale, we're going to gently lift our tailbone up, and notice your lower back is flattening now. And then inhale, let it come back. Just exhaling now and lifting tailbone and pressing the lower back gently flat. And then inhale, let that tailbone go down. And last time, so now we're going to exhale. I want you to press into your feet, lift your tailbone, and then peel up your spine. Lift, 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 lift. Squeeze the block. Press into the backs of the arms. And take a breath. And then as you exhale, come down slowly on the mid back. And then feel it coming into the lower back. And then finally your pelvis rocks forward. Let's do it again. So we want to lift our tailbone first, and then we peel up the spine. So basically we're going into a posterior tilt, so the back flattens before we lift it. We don't lift up through our navel because that compresses your low back. By lifting the tailbone up first, it lengthens the low back. So it's super important. Okay, let's try it again. Deep breath in. The exhale, start lifting the tailbone and pressing into the feet, and then up you come all the way up. Press into the arms. Breathe. Squeeze your block. Press into the feet. And one more breath. And then exhale, bring it down nice and slow. Nice and slow. And we'll do that 2 more times. Inhale. The exhale, start lifting tailbone and then peel your whole spine up. Press into the backs of the arms, press into the feet, and squeeze that block. 1 more breath. And then roll it down. So we're not holding it, we're just warming up things. And now we'll do it 1 more time. This time we'll hold it a little bit. Breath in. And then the exhale. Start lifting tailbone, press into the feet. Lift your spine up, all the way up. Squeeze the block, press into the feet. Now, once we're here, draw your navel in and up, and your tailbone points to the heels. So you're lengthening the low back. As we continue to stretch the front of our hips, now we're working on the posterior chain. We're working on our glutes and our hamstrings right now. So 2 more breaths, and we're also, as we press into the floor with our arms, we're strengthening the backs of our shoulders. Couple more breaths, just breathe deeply. Exhale, really pull navel in and up and tailbone towards the heels. And last breath. And then inhale, and then exhale, roll it down. Nice and slow, nice and slow. So that variation of bridge, when we lift tailbone first, really gets your hamstrings to fire. Now I'm going to give you another version of this where it's going to work mostly on the glutes. Your hamstrings are still going to be involved, but mostly the glutes. So as you notice, when we did that one, first we put in we lifted the tailbone, which actually puts your lower back flat, posterior tilt. When you're in a posterior tilt, whether you live life like that, your hamstrings are shortening. They're getting really, really contracted. So now what we're going to do is try this with a neutral pelvis. So when you're in a posterior tilt and you lift up, it really works the hamstrings. Now let's bring the focus to the glutes. And the thing that makes the difference is the position of your pelvis. So let's find the neutral pelvis. So it's not flat, it's not tipped forward, it's right in the middle. Once you get that, draw your ASIS together. Now, we're going to lift up, keeping neutral pelvis. So take a breath. And as you exhale, I want you to push into your feet. Keep that ASIS drawing towards one another. Lift up. Now squeeze your buttocks towards one another. Squeeze, squeeze, squeeze. Squeeze. Inhale. And then exhale, roll it down. Now we're going to do it 1 more time. And I want you to, before we do it, bring your hands to where your buttocks and your thighs meet. Just at that. We call that the gluteal fold line. So when we come up into it, I want you to feel the hamstrings, which is the back of the thigh. Make sure that they're soft and squishy. When they're soft and squishy, that means they're not working. And we don't want them to work right now. We're working on our glutes. They might work a little, but you should feel them kind of soft. So let's try it again. Find your neutral pelvis. Lock it in by drawing ASIS towards one another. So we're going to keep that. Inhale. Exhale. Push into the feet. Keep neutral pelvis. Lift up. Now squeeze your buttocks towards one another. Bring your hands here and touch and make sure they're not really tight. You should feel squishiness here. Navel in and up and buttocks towards one another. So you're squeezing, you're pressing into the backs of the arms. So now we're working the glute maximus. Let's stay here and breathe. Deep breath. Exhale, maybe navel in and up, tailbone heavy. ASIS towards one another. And one more breath. And then exhale, roll it down. So 2 different variations. Take your block out. And let's now push ourselves up.
And we're going to start to stretch our hamstrings. So we have 3 hamstring muscles. We're going to do each one separately so that you get a really, really good stretch on them. So grab a strap. I'm going to do another video soon, a wall practice. There's a way to stretch your hamstrings that's super, super good, but we need to have a corner or a door jamb to do it with. But we'll do that at another time. So right now we'll just use our strap. I'm going to lay this way so that you can see the angle of my leg. So let's lay back. Now when we're doing this, I want you to keep a neutral pelvis. Take your strap. First find your neutral pelvis, lock it in. Take whatever you're using, let's bring it around the arch of the left, either the ball of the foot or the arch of the left foot. We're starting with the left leg. Now find your neutral pelvis. Lock it in with the ASIS drawing towards one another. Your other foot is on the floor with a knee bent. So the secret here is keeping neutral pelvis. Bring the strap so that the backs of the arms are supported, so that you're not up here and you're not up here. You need long enough strap so that you can have the backs of the arms on the mat. Now you want to keep neutral pelvis. Take a breath. And as you exhale, I want you to bring this leg towards you. And breathe. So your leg should be straight. So if your knee is bent, I want you to lower the leg until it's straight, and that's your starting position, and it's okay. So you want to stretch from a straight leg, whether it be here or here or here. Keep neutral pelvis and breathe. So think about gently pressing your thigh back towards whatever's behind it, towards my curtains or whatever's behind you. And breathe. Navel is the ASIS are drawing towards your navel. That keeps that lumbar spine in a nice neutral position. And it keeps your core engaged. So we're working core. And one more breath. So this is your middle hamstring. And the next one we're going to do, we're going to take our leg and draw it to the left about 12 inches. So not all the way out, just about 12 inches. And then keep neutral pelvis, take a breath. And then as you exhale, draw it towards you. Press the thigh towards the wall or whatever's behind it. Keep ASIS drawing towards one another. And breathe. So you want to stretch, like I said, with a straight leg. Couple more breaths. So this is hamstring number 2. And now we're going to stretch the one that's usually the tightest one. So bring it back to center. We're going to take the leg 12 inches towards the right. So inhale and exhale. You're crossing it across the midline. You're going as far as you can, keeping neutral pelvis, and that's probably as far as you'll go because this one's the tightest one.
This is the biceps femoris, the lateral hamstring that gets super duper tight on most people. So no wincing allowed, just breathe slow and smooth through it. ASIS, draw towards one another to keep your back supported. The back of the thigh gently pressing towards the wall. And breathe. Backs of the arms are supported by the floor. And one more breath. And then bring the leg together, back to center. Let's change feet. Find your neutral pelvis. And we're going to stretch. I'm going to turn this way. This is my leg. I had a hip replacement on, so this leg is not quite as flexible. See how my knee is bending? I'm trying to bring it up, and my knee wants to bend. That's not what we need. We need to lower it and not let our ego say, oh, I want to do this. You want to start where your body is and be okay with that. So find neutral pelvis. Your back is not flat. Find neutral pelvis. Lock it in by drawing ASIS towards one another, backs of the arms to the mat. And inhale. And as you exhale, gently give a little bit of a pull, a resistance to this leg until you feel the stretch. You want to feel it in the back of the leg, not on the back of the knee, not on the sit bones, right up by the hip. You want to feel it, or by the glute rather. You want to feel it in the middle of the muscle, the belly of the muscle. And breathe. Neutral pelvis. Breathe in. Each exhale, gently draw ASIS towards one another a little more. So we're training our body right now to stay in neutral pelvis. Rewiring sort of our brain. It's called neuroplasticity, where we can retrain the way that our brain communicates with the muscles by, retraining them in the right way it should do things. We've gotten into bad habits, basically. We're trying to create better habits for our body. So now let's take our leg, our strap, and draw it to the right about 12 inches, not too much, about 12. Keep neutral pelvis. I have a super duper way of doing this on a wall, but we'll do, like I said, we'll save that for the next practice, a wall practice. I hope you guys are doing okay throughout this pandemic we're in. I think it's going to be ending soon, hopefully. I had my first vaccine a couple weeks ago. I've got about 10 more days to go, and then I'll get my other one. Now bring your leg back to center, take a breath, and then exhale, bring it towards midline, across midline. Don't let your right hip get up too far from the ground. You want to feel this on the outer part of the right thigh. And breathe. So this is a real thorough stretch for your hamstrings. Usually we just bring the leg straight back and call it quits. I'm giving you each hamstring a separate stretch, so you're going to walk away with a better stretch. If you have super tight hamstrings, remember you're stretching from a straight leg, and I would do this most days. Most days. If you start and you're really sore, give it a couple days, rest, so when it's not too sore anymore, start again. And maybe 3 to 4 times a week, I would suggest. Tight hamstrings pull that pelvis into posterior tilt, and it causes other issues to pop up throughout the body. So we want to start to create that neutral pelvis. And then bring your leg back, and then bend the knee, take your strap off. Alrighty, let's see what else we're going to do. So after that, let's come up to seated. I want to do one. This one here is called Deer Pose. Excuse me. What we're going to do is we're going to sit. You're going to sit in your Sukhasana just for a couple minutes and breathe and see how you're feeling. Lifting the spine
and just seeing how you're feeling. How does that feel? Are your hips tight right now? Practice this practice a few days a week and be consistent with it, and they'll loosen up. Now what we're going to do, it's a pose called Deer Pose. So we're going to sit with, this is my right leg, my knee is right out from my hip, and then I'm going to bring my ankle out from my knee so that I form a 90-degree angle. Now the back leg, same thing. Knee out from my hip, ankle out from my knee. So this is a big stretch. So this front leg is in external rotation. This front hip is in internal rotation. So this is called Deer Pose. This is the full expression of it. If you're super tight, maybe this heel will be in and this heel will be in. So you got to start where you are today and feel okay with that. So whatever position you're in, I want you to lift your spine so that you're not tipped over. Lift up. If this knee is way up in the air, you might want to put a little pillow under it or a towel. If this knee is up, you might want to put a little something under it too. So that's pull your navel in and up, draw your ASIS towards one another a little bit. Gently push this back knee, which is my left, gently into the floor. Lift your rib cage off your pelvis. Think about looking at the horizon, so your chin is not looking up and it's not looking down, you're just looking straight ahead. And breathe. So feel the opening in this hip, feel the opening in this hip. Good job. I know this is a hard one. We start where we start and we're okay with that. You're going to see my next hip, it's not the same. So sometimes we're asymmetrical beings, meaning one side is not the same as the other. And with our yoga practice, we can really see that and then work on the side that needs more work, that needs more attention. And now let's come out of this. And I already know that I'm going to need something under one of my knees, so I'm going to grab a blanket. So now I'm going to put my left forward, so my knee out from my hip, and then I'm going to bring the other one back. So look at this one. See how this is my tighter hip. See how the knee is up? So you want to put something under that knee so you have something to push into. So once again, do the best you can and sit up straight. So push down this knee. Both knees are pushing down and you're in whatever variation you're in. You're going to feel a stretch here. You're going to feel a stretch here. So navel in and up, ASIS, gently draw together. You're lifting your rib cage off your pelvis and you're looking straight ahead. So as you inhale, I want you to think about your crown of the head lengthening up. So you're creating space in the spine. And then as you exhale, just very gently ASIS towards one another. So the inhale, the spine lifts, the head lengthens away from the pelvis. And then the exhale, gently a little bit of engagement of the core. And let's stay here 2 more breaths. So for my body, this leg, this hip is super tight, so I need to work on my left hip. So when we find one of our hips tighter than the other, we want to give that hip a little more attention, meaning, say I do something twice on my right leg, I'm going to do it 3 times on the left. Just to balance, bring it back to balance. Yoga is all about samatha, is balance, bringing the body back to homeostasis, back to balance. That's when everything works better and we don't have so many aches and pains. So let's come off of that. Let's bring our legs straight ahead and let's shake them out. We're going to do one more today. A lot of us have, like I say, super tight hips. So I want to do one for your piriformis and the outer hips, your external rotators. So for that, we're going to lay on our side, so head supported. So I'm going to lay my right side down. So we're going to start to work this area. So bring your knees into a 90-degree angle, knees and ankles. Pull your navel in and up, ASIS together.
And keeping your feet together, let's inhale and lift your top knee up and push it forward. And then exhale down. So it's up and forward and then down. So inhale up, exhale down. So you don't want to inhale and roll back. That's cheating. And down. So the core is engaged so that we're just feeling this hip socket move. Up and down. 2 more. Exhale up and inhale down. And exhale up and inhale down. Now, keep the bottom leg bent and straighten out the leg, the top leg. Look at your foot. You shouldn't be able to see more than half of the foot, the toe half. You should see your toes and the arch. So if you can see the whole foot, you need to bring it back so that it's aligned up. Everything zipped up in the core. You're going to inhale, lift the leg up, and then exhale, lower it. My foot is flexed. And, excuse me, inhale, lift, and the exhale, lower. And lift. So we're warming up this area of our glutes. This is your glute medius. With the clams, it was your external rotators. And now we're going to stretch them. But we're warming them up first. Like I said, a muscle responds better to a stretch if it's been warmed up first. It's more pliable, blood supply there, warmth. Let's do a couple more. So feel it as you lift, 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 and lower. And last time, lift. Now we're going to hold it. So notice my ankle is pretty much in a line with my hip. And right here, I'm feeling this muscle work. This is your glute medius. Very important with balance. And then bring that foot down. Bring your knee in and tap it out. Tap it out. Let's do the other side. So we'll start with the clams, which very good for your hips. This is a big hip day. So get your pillow just right or whatever you're using so your head is an addition of your spine. It's not up or down. Get in 90 to 90. Navel in and up, ASIS together. Feet stay together. So as you inhale, draw your top knee up and forward. And then exhale, lower it. So don't roll your torso back. Lifting up and lowering down. So inhale, lift, and exhale, lower. And inhale, lift, and exhale, lower. You should feel it right here. Inhale, lift, and exhale, lower. This is one of the, you hear about the piriformis and sciatica. We're strengthening it right now. One of 6 deep external rotators of the hip. And let's do 2 more. Inhale, lift, and exhale, lower. And inhale, lift, and exhale, lower. Keep the lower leg like it is and stretch out that top leg. Look at the foot. You should be seeing just the toes, maybe a little of the top of the foot. Navel in and up. Bring your foot down, take a breath. And then exhale, lift. Inhale, lower. Flex the foot and lift. Feel it here. And lower. Glute medius. And lift. And lower. And lift. And lower. Make sure you're not tipping. So your core is keeping your pelvis nice and steady. So now we're getting really, really work on this hip. It's not always about stretching. We have to stretch, yes, but we have to strengthen too. And now lift and hold. Lift and hold. Keep your core engaged. And breathe. Don't hold your breath. And then bring it in. All the way in and tap it out. Now we've warmed up this, haven't we? Now we're going to stretch them. So there's a pose, a variation of pigeon. I'm going to give you a couple variations and you're going to be able to pick which one you want to do. So the first one
is just, if you have a couch, that would work good. If you don't, first I'll show you without. So with this one, you're gonna take, I'll turn this away so you can see me better. You're gonna bring your right thigh in, cross your right ankle over the left, and open up. This is figure 4. This is how we start it. So if this is feeling a really good stretch to you, you stay here. If you want more, you bring your thigh up and in and lay back. But you can't be up like this. You need to have your head supported and your back supported. So here's level 2 of pigeon. Now, if you'd like, and you have a wall handy, or I'm using my sofa to show you, you can bring your leg, put one foot on the couch, have your 90-degree angle, and just bring this leg up. It's a little bit easier on the hip. So you choose out of one of those 3. So I'm going to stay with this one just for a couple breaths. And then I'm going to show you another option too, the pigeon pose. We call this one figure 4. But in yoga, it's reverse pigeon. Okay. So now let's come out of that. Let's warm up the other side. So let's, whatever variation you're doing, whether you're doing on the floor or using a sofa, let's bring your left thigh in, cross the ankle over, and I like to use my hand to just push this thigh away. This top foot, flex it. And just this left hip, push it up and out. And breathe, 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 breathe. These are the ones get really tight from sitting. The whole hip area does, but these guys really do. Two more breaths. And now I want you guys to come out of it. We're going to go back into it one more time. We're going to do each side one more time, but I wanted to give one more variation. This is the pigeon pose. So for this variation, it's a little more demand on the body. So you come into tabletop. You bring your right knee towards your right hand, and you open your foot out just a little bit. Then you slide the left leg back. Now this is my right knee. What I want to do is open it up a little bit. And then I'm going to come down to my forearms and I'm going to look straight down. My left leg is reaching back. So I'm not sinking. I'm pushing the floor away and I'm activating my shoulder muscles to do this. So my forearms are pressing away and I'm feeling a nice stretch in this right hip. So whatever variation, if this one doesn't work for you, I want you to go back and do the one that you did before. So a couple more breaths, just giving that outer hip a good stretch. So whether you're in this variation or the one that I showed you with the sofa or the one with just on the floor, just breathe deeply and slowly. This is stretching your piriformis. And like I said, 5 of the other deep external rotators of the hip. But the piriformis gets a lot of press because when it gets angry, it causes sciatica pain. So this is a good stretch for it. And then let's come out of this. We're going to do the other side again. So if you're with me, come onto all fours. I'm going to come this way this time. And then I'm going to bring my left knee towards my left hand. I'm going to kick my foot out just a little, then slide the right leg back. And then take this right knee and open it up a little. And then come down on my forearms. But I'm not sinking between my shoulder blades. I'm pressing the floor away, filling up that space between my shoulder blades. And I'm working my serratus anterior muscle, which is a super important muscle for our shoulder health. So deep breaths, feel the stretch in the left hip. You can activate your core here. Navel in and up.
ASIS towards one another, looking straight down, so not cocking the head up or tucking the chin, looking straight down. Couple more breaths. Nice hip opener. And now let's come out of it. Okie dokie. So whatever variation you did with that pigeon pose, I hope it brought some relief to tight hips. So let's do one more and then we'll be done. I want you to lay down and then just take a break for a minute. Palms face up. Go inside and sense your body. What do you feel? Start with your feet. Move up to the calves, into the knees and into the thighs, and then into the hip crease, the buttocks, the lower back, the abdomen, the shoulders, the arms and the hands, and the back of the head. So let's just stay here in Shavasana for about a few breaths. I want you to be aware of what you're feeling. If the low back says, I need something under my knees, then I want you to redo your posture. You can also bring your chair and start like we started with the legs up the chair. I'm going to choose to use a blanket and just put it under my knees. And lay back. Whoops. Palms face up. And just breathe. Feel the body. Connect with your breath. This time I want you to bring awareness to your navel. And think about you're in a swimming pool with one of those big inner tubes around your tummy. There's about an inch between your tummy and that inner tube. So when we breathe, we're going to start in the middle of the navel, but I want you to breathe into the front, into the back, and to the sides, as if you're trying to fill up that inner tube. So your breath is going to expand your body, and you're trying to breathe so deeply that you're bringing your body into that gap of that inner tube. Ready? Feel the body heavy. Feel the feet, calves, backs of the knees, the buttocks, the mid-back, shoulders, arms, hands, and the head. Now bring awareness to your navel. And as you breathe in deeply, bring breath to the navel and bring it all the way out to all sides of that inner tube, breathing in. And then slowly release the air. Feel the body contract away from that inner tube. And breathe again, inhale. And then exhale. And let's do that a few more times. Oxygenating every cell of your body. And now as you exhale, sink deeper. Let go of tension. And keep breathing like that. This part of practice is super important. Don't walk away. This is when what we just did, your body starts to assimilate it into the tissues and makes use of all the good postures and the stretching and the strengthening we did. Your body is integrating it now. So breathe deeply and bring in the oxygen that it needs. And then exhale fully, bringing the relaxation that the body needs. Stay here 3 more breaths. And now gently open your eyes. Blink them open a couple times. Bring movement into your fingers and your toes. Circle your wrists. Gently engage your core and then bend one knee, bringing one foot to the floor and then follow with the other. Roll to one side. Stay in fetal just for a couple breaths. Then using the top arm directly out from your shoulder, press yourself up.
And let's come to seated. And let's bring our hands to our heart in Namaste Mudra. So lift your chest. Think about lifting your chest into the backs of your thumbs. Draw your navel in and up, ASIS together. And look at the horizon. And thank you so much for joining me today. I hope this helps your tight hips. If you do it regularly, it will help you. Remember, don't push into pain. And I thank you for joining me. Have a good evening. See you next time.